You're watching KRCR News Channel 7 Severe Weather First.
The following is paid programming. The content within this program is not endorsed by KRCR or its affiliates.
You're watching NorthState Health, the North State's first local health program.
Good afternoon, I'm Tim Mapes. Thank you for joining us for NorthState Health, the only show dedicated to bringing you the information you need to live a healthier and happier life. Our guest today is Dr. Mohammed Khan, a well-known cardiologist in Reading, recognized as a 2010 leading physician of the world by the International Association of Cardiologists. Dr. Khan, welcome. Thank you for being here. Let's start with how long you have been in the North State and what brought you here.
Thank you, Tim. I've been here for about 7 years now, and my family lives in the Sacramento area. And I was thinking about relocating and being closer to my kids. And when the opportunity came up to restart the program at Shasta Regional, I looked into it, and that's what got me here, just to be closer to family and the kids.
That's great. And obviously, we are here today. We have a very, very, very important topic. There's a reason we chose this topic as our first one for this series. And what are we going to be talking about today?
We're going to be talking about hypertension or high blood pressure. High blood pressure is the leading cause of death in the world. It is more important than cigarette smoking. It is more important than cholesterol. It is more important than alcohol. It is more important than being overweight. It is the single most common condition for which patients go to see a physician. Yet less than half of our patients, and this is half of our patients who are on medication, have their blood pressure controlled. It is so easy to diagnose. You just need a blood pressure cuff. And it is so easy to treat. We have over 150 agents on the market, but less than 50% of our patients who are on treatment are being treated appropriately. So it's a very serious condition, and that is why I thought we'd talk about hypertension first.
Okay, you see on the screen there we have some of the statistics here, and that was going to be one of my questions. Is this a condition that could actually be, I mean, is anybody at risk? I mean, I know it says they're over 65, but could I be at risk? I'm in my 30s. Can teenagers, can kids be at risk for this as well, and should they be looking out for that?
Absolutely. The recommendations are, Tim, that from the age of 3, somebody should have their blood pressure checked. Definitely from the age of 18 to 20, the American Heart Association recommends that every adult above the age of 20 must have their blood pressure checked. And if it is normal, you need to check it every 2 years. Every 2 years. Now, it is extremely common, as you mentioned. After the age of 55, 90% of us will develop high blood pressure. 9 out of 10 of us will develop high blood pressure. And as you've seen on the screen, every other patient above the age of 65 will have high blood pressure. So it's extremely common. We're all at risk, and we need to have our blood pressure checked regularly.
Okay, you were also talking about, like you said, their third most common cause leading to disability, and this starts really, really early. I mean, that was pretty shocking that you said a child, 3 years old. I have a 3-year-old daughter. We should be checking her for high blood pressure. It can happen.
Absolutely can happen. It is not very common, but because the consequences of long-term hypertension can lead to such disability, that it is very important that we have our kids and ourselves tested.
Okay, it's definitely, you can see there on the screen the children there. What are some things that you can do? I mean, is it exercise or something like that? What is the best way to combat this from the get-go?
Well, from the get-go, the most important thing is exercise and educating our children on good eating habits. Salt intake is one of the leading causes of high blood pressure. We need to decrease our sodium intake. Americans eat far too much salt than we need. And this notion that sea salt is better than table salt is also false. Our sodium intake for anybody who has high blood pressure, who has diabetes, who has any kind of kidney problems, or if you're above the age of 50, your sodium intake should be less than 1,500 milligrams a day. Less than 1,500 milligrams of sodium is what we need as our intake of salt. If you don't have high blood pressure, we still need to curb our salt intake to no more than 2,300 milligrams, which is less than a teaspoon. And when I talk to patients and I tell them to cut their salt intake, most patients tell me, I don't add any salt to my diet, but it is mainly the salt that is in packaged or processed foods. We need to read the labels so that we can decrease the salt intake. And of course, the other thing is exercise, as you mentioned, because obesity is the single commonest condition that causes hypertension. So if we can watch our weight and exercise, we reduce our chances. Because if one parent has high blood pressure, the chances of developing high blood pressure is 25%. If both parents have high blood pressure, you have a 75% chance of developing high blood pressure.
Wow.
And as I mentioned, we have some patients that are vegetarians, some patients that are skinny and at the gym, but they still have high blood pressure. So it is important not to think that if you exercise and you're healthy, that you are not susceptible to developing high blood pressure.
Okay, so it could be a diet, like a high-fat diet, so that you are overweight, and that could be a danger. But then for me, I'm not overweight, but my diet could still have way too much sodium, so that could be the problem.
Absolutely. And genetics, of course, can play a role.
Okay, all right, thank you. Well, we are going to take a quick break and come right back, so stay with us.
Painting your home or business? Call the professionals.
NorthState's first local health program.
Welcome back to North State Health. I'm Tim Mapes. Again, we are here with Dr. Muhammad Khan, Reading cardiologist, and with the Cardiovascular Center in Reading. And we are talking about high blood pressure and hypertension. Just a very quick recap here, what we were talking about. The shocking part of the last segment, I thought, was anybody is at risk. And you were talking about children, 3 years old, all the way up to 65, and the dangers and how horrible it is. But we also want to talk about the numbers. Let's really hit those numbers. I think those can be very, very confusing for people when you're talking about, 120 over 80. What should you be looking for? So take us through these numbers. We are going to have some graphics and just kind of explain these in depth for us.
Well, a normal blood pressure is less than 120 over 80. Between the blood pressure of 120 to 140, we say those patients have pre-hypertension. But if your blood pressure stays constantly at 135 over 85, you double your risk of having a heart attack or stroke. If your blood pressure is 155 over 95, either or, whichever one is higher, your risk of a heart attack and stroke is quadrupled. And if it is 175 over 105, you have an 8 times risk of having a heart attack and stroke. So you can see that it is very important to have these numbers well understood and well controlled. To make it very simple, as we get older, the top number goes up and the bottom number goes down. You can see from this graphic that if you are about 45 or 55 years of age, and if your blood pressure is just slightly elevated, around 145 over 85, your risk of a heart attack, kidney failure, heart failure is 3 times, and your risk of a stroke is increased 4 times. So just small elevations in blood pressure translate into significant increases in the patient's risk of a heart attack, heart failure, kidney disease. So to make it very easy, if somebody can keep their blood pressure less than 135 most of the time, regardless of age, because remember I said at 135, your risk of a heart attack and stroke is doubled. If you keep your blood pressure less than 135, just that one thing alone, you reduce your risk of a heart attack and stroke 50%. So if the numbers are confusing, just remember 135, because as we get older, the top number keeps going up, and that is why as we get older, your blood pressure is higher. But as you get older, your bottom number tends to go down. So your lower number goes down, your top number goes up, and that's why your risk of a heart attack and stroke increases as you get older. So remember 135. If there's anything you can remember, 135. And if your blood pressure is consistently more than 135 or more, you need to check with your physician.
All right, 135, the magic number that we have to talk about. Now, we were talking about going and getting yourself, tested, keeping track of that number. Everybody, all we have to remember is 135 whenever we check. You did say how many times a week we should be checking, even healthy people, older, younger, we should just be aware of what that number is.
If we should be aware of it. Now, if you have high blood pressure, the best is to check your blood pressure regularly. Let's say if it is well controlled, you can check it once or twice a week. Check it the same time, preferably in the morning, because most heart attacks and strokes occur in the morning. But check it regularly. If it is elevated, then check it more often, because a lot of times patients will come to me and say, my blood pressure has always been well controlled and now it is suddenly high. And when I asked them when was the last time you checked it, they said 2 years ago. So it may have been high for about a year. So it is important to check it regularly.
Okay, you were talking about, you can get the blood pressure machines. I have members of my family who have those blood pressure machines, but it actually is very easy to check it on the go. Everybody has to go to the supermarket. We've all seen those machines that you go in, you put your arm in there, you relax a little bit, while you're doing the pressures of shopping. But how accurate are those? Are those a good thing to go to if you're in the supermarket?
That's a great question, Tim, because when those blood pressure machines are initially installed at the supermarkets, they're very reliable. But how often are they calibrated? How often are they checked? We don't know. So yes, it helps you because it's easy, it's free, you can check your blood pressure, and if it is elevated, then you've got to check it more regularly. Now, the blood pressure machines that you asked about, checking it at the machines that we can purchase from Walgreens or Costco and so forth, the recommendations are to buy the machine that will check your blood pressure at the upper arm. That's the most reliable. The ones at the wrist are less reliable, but they're not bad, and the ones that take your blood pressure from the finger are the least reliable. Now, the most important thing is blood pressure readings are definitely more reliable at home than at the doctor's office. So it is important to check it at home. Now, what you need to do, though, is when you have one of those machines, take it once a year at least with you to the doctor's office to correlate the readings with the doctor's office machine to make sure that it's reliable. And if it is close enough, then your machine is fairly reliable.
Yeah, and one of those things also, if you have one of those machines, if you use the ones that are in the supermarkets, or if you have a home machine, how important is it to make sure you don't have a big thick sleeve or something like that to make sure it's accurate?
Another very important question, because most of the time we're just not checking the blood pressure as accurately as we should. So this is the best way to do it. Check it when you're relaxed in the morning. Make sure that the cuff that goes around your arm fits about 80%. It should cover 80% of your arm. It shouldn't be too tight. It shouldn't be too loose. Your arm should be relaxed on a table so that it can be at the level of the heart. And you want to make sure that if you're very thin, you should buy a cuff that will accommodate your arm and it's not too big. And if you're a large person, you can buy one of the larger cuffs to go on your blood pressure machine. So it's important to check it accurately because that can make a difference in the blood pressure readings.
All right. Thank you, Dr. Khan. We have more to come. NorthState Health will be right back.
KRCR is an equal opportunity employer. KRCR, as required by the Federal Communications.
Indeed. Welcome back. I'm Tim Mapes, and joined here by Dr. Mohammed Khan, a noted cardiologist in the Reading area. And we're talking about high blood pressure today. Very, very, very serious problem, as we have talked about earlier in this show. Let's talk about it. You have high blood pressure, let's say. You know it. You go to your doctor. You're on an exercise plan, you're on a diet plan, which, as we've said, is one of the most important things you can do. But let's talk about if you get put on high blood pressure medicine. Is there a certain time of day that you should take that, or should it just be consistent, or what? Tell us about that.
That's a great question, Tim. Like I mentioned earlier, most heart attacks and strokes occur in the morning. So you want your blood pressure to be very well controlled in the morning. Now, if one of your blood pressure pills is a diuretic, then you should take that in the morning, because you don't want to go to the bathroom at night. If you take it at night, you'll be running to the bathroom more frequently and more often. So the best is to check your blood pressure in both arms. Make sure that you always, whenever you check it in the higher arm. I was just relating to the graphic that we've seen on the screen. Mm-hmm. But back to your question, take the blood pressure pills at night, because the blood pressure pill does not act immediately. It takes 4 to 6 hours before it really peaks and has its effect. So if you take it at night, your blood pressure is going to be very well controlled in the morning. So it is better to take your blood pressure pills at night. And always check your blood pressure about the same time. You can check it before you take your medication at night. You can check it in the morning, but check it the same time every day, preferably in the morning.
Okay, you'll get that accurate reading that you're going to be looking for. Also, are there certain vitamin supplements that you can take that'll help this, or should you avoid those things, or should you just talk to your doctor?
You know, I'm not a big vitamin fan. I was listening to a radio program, Dr. Dean Adele, who's been on the radio for over 30 years, and I remember a patient asking him whether he should take vitamin supplements, and his answer was that if anybody should promote vitamins, it should be me, because my parents put me through medical school selling vitamins. But no, unless there's a reason you need a supplement. If your doctor tells you you need a supplement, then you need a supplement. Most patients don't need vitamins. Unless you're ill, terminally ill, you can take a multivitamin. But vitamins, either way, will not affect your blood pressure. There are certain pain medications, like Motrin, ibuprofen, that can blunt the effect of some of the blood pressure pills, and also can cause high blood pressure.
Oh, wow.
So you want to be careful taking some of these blood pressure, these pain medications.
Okay, so it would counteract what you're taking and has more harm than good sometimes.
Sometimes.
All right, thank you. We are going to be right back. We're going to talk about if that morning cup of joe or whatever you use for a pick-me-up is going to affect that high blood pressure.
Can anyone tell me where to find a good winery?
Number that you should look for, the magic number that everybody should think about when you're taking your blood pressure, 135, is that what it was?
Correct.
135, that's the number. We are talking about, though, some of the things that cause high blood pressure. We've talked about smoking, we've called alcohol, we've talked about obesity and salt, sodium, your intake from processed foods and that type of thing. But how about you have a good diet, you watch it, but you're one of those people that everybody's stressed these days in terms of their jobs and stuff like that. You wake up, you need that pick-me-up. What about coffee and things like that you take, sodas, the stuff that has caffeine? How much can that actually influence your high blood pressure?
That's a great question, Tim. It leads into what I said earlier, that most heart attacks and strokes occur in the morning because you're getting up, you're going, you grab that first cigarette, you grab that first cup of coffee. The first cup of coffee can raise your blood pressure 15 to 30 points. Each subsequent cup will raise your blood pressure about 10 to 15 points. That first cigarette can raise your blood pressure 10 to 15 points. Every time you smoke, your blood pressure goes up 10 to 15 points. So it is important that you try to cut out your cigarettes, of course, try to curb your coffee intake, but 2 to 3 cups of coffee don't make a difference. And coffee does not cause permanent high blood pressure. It just raises it about 10 to 15 points, and about 30 minutes later your blood pressure is back to normal. So if you check your blood pressure, and as I said, the best time to check it is in the morning, make sure you check it at least 30 minutes after you have a cup of coffee or 30 minutes after you have a cigarette. It's preferable to take it before, but if you happen to have that coffee or that cigarette, wait at least 30 minutes before you check it.
Okay. Well, we were talking about how high blood pressure can strike obviously the elderly, but also you were talking about children as young as 3. So when you're talking about that, those energy drinks that are so popular with teenagers and college kids in their 20s, those can hurt you too.
Absolutely. Besides causing palpitations, a lot of those energy drinks, it can raise your blood pressure as well.
All right. Well, one thing I was also going to ask about, we've talked about all of the dangers and what can cause it. Obviously, you can avoid some of the dangers that we've talked about, but what are some quick tips that people can remember, that are easy to remember, that can really help control this?
There are a lot of patients that don't want to take medication. They're resistant, but they have to understand that this is a silent killer. There are no symptoms. Unless you check your blood pressure, you won't know it is high. So the first tip is to check your blood pressure. The second is to keep it low. You can see from that statistic again that you want it less than 135/85. And again, a normal blood pressure is 120/80. Your risk begins from about 115, 117. Every millimeter that goes up, your risk of a heart attack and stroke goes up. It is just when it's 140, the risk is parabolic or significant, and that is why we use the 140/90. But the other thing that's important is for patients who don't want to take medication or really want to lower their blood pressure, if you lose about 10 to 15 pounds, you will lower your blood pressure about 10 to 15 points. Again, alcohol is the single most important thing that makes it difficult to control blood pressure.
Wow.
So whenever somebody comes in and we have difficulty in controlling their blood pressure, I ask them how much of alcohol they're consuming. If you cut your alcohol intake, you have a better chance of controlling your blood pressure. Again, what is very important and helpful is make sure you check your blood pressure in both arms and follow the blood pressure in the higher arm. Also, for patients who are interested in a particular diet, there's a diet called the DASH diet, Dietary Approaches to Stop Hypertension. It's the DASH diet, which is the best diet in patients who have high blood pressure. Those are some of the helpful things that patients should think about. Again, as we talked, exercise, weight loss, alcohol cessation, and checking your blood pressure regularly.
Now, the DASH diet, people can obviously go on the internet and maybe look into that and find out what kind of foods kind of go along with that.
Absolutely.
Okay, what blanket statement, just real quickly, what would that be?
It's basically fruits, vegetables, nuts, and what kinds of seafood to have, what kinds of nuts are beneficial, which won't elevate your blood pressure and so forth.
All right, thank you very much. We're going to have more coming up on NorthState Health right after this break.
Can anybody tell me where to find a good pizza parlor? I'm looking for a good dentist in town.
Program, you can go to krcrtv.com/NorthState Health. There you will find information on all of our doctors, tips from the experts, and you can watch entire shows from your computer. Very simple. So if you missed anything, we had a lot of information today. You can go watch this back again. Again, I would like to thank Dr. Khan for joining us this week. And you can also join us next week for another edition of NorthState Health. Dr. Khan, thank you very much for imparting that wisdom. It's definitely stuff that you can do right off the bat.
Thank you, Tim. I hope this was helpful. And like you say, it's at the website and patients can go and listen.
All right. See you next time.